We are transitioning to phase 2 of our vaccine distribution plan, meaning that we are beginning to offer vaccine to first responders, an expanded group of healthcare workers, and in some areas we'll be able to start vaccinating those in the 65 plus population, depending on local vaccine availability. Keith Reed and his team have done an excellent job so far with vaccine distribution. We have an appointment set for every single dose we have currently in Oklahoma. I want to assure you that we have a statewide plan that's being implemented right now, but parts of that plan are driven by local needs within our county health departments. This is how we ensure that the vaccine is getting to Oklahomans as quickly and efficiently as possible. This is our top priority. Moving forward, we're expecting around 30 to 40,000 doses arriving. Those are prime doses arriving to Oklahomans every week. Our vaccine rollout can only go as quickly as we're getting supplies from the federal government. This is consistent with the pace of vaccine distribution across the country. As well, we're continuing to work vaccinating Oklahomans as efficiently as possible. I want to continue to encourage every Oklahoman to get the vaccine when it's your turn. It is safe and effective and will help us move back to our new normal. We know that the key to getting the vaccine to all Oklahomans is being able to schedule appointments. This week, we'll be rolling out a vaccine appointment scheduling app. It should be available for Oklahomans later this week, as early as Thursday the 7th. Oklahomans will be able to use this app to see approximately where they fall in the vaccine distribution plan and to schedule their vaccine appointments when it becomes available to them. We'll announce how to access the app once it's fully functional on Thursday, so stay tuned for more details. Finally, last week, we announced that we are establishing pods. These are point of distribution sites across the state in coordination with local partners and county health departments. These are to increase our access points for vaccine throughout the state. This will help us move into phase 2 and begin offering the vaccine to those that are 65 and older. And all this will allow us to continue to distribute the vaccine across the state. And now I'd like to turn it over to Keith for more information on where we are in the vaccine distribution process.
Happy New Year to everybody. I'm glad to be here with you. So yeah, it's been a busy time. The first 2 to 3 weeks, as you are aware, we've been focused on our phase 1 groups, our priority groups like the hospital systems, our long-term care groups, and now we are certainly moving into some of our phase 2 categories, as the commissioner mentioned, including expanded healthcare workers, first responders, and this week we are opening up in many locations to the 65 plus population. Now, I do want to be clear on that. That is 65 plus. We're not yet moving into those younger with comorbidities. We need more vaccine inventory to add that additional group. But for now, we have started with the 65 plus categories. We have pods, as the commissioner mentioned, set up all across the state. In fact, we have approximately 90 of those scheduled for this coming week, scattered in all parts of the state. Those are what I would consider to be high throughput model pods. They are coordinated with local communities, led by the local county health departments. They probably will not be held at a county health department. They'll be held at other sites that are capable of handling larger groups of people. So with that, this kind of marks our transition into a higher throughput model with vaccine delivery and administration. As you've seen up to this point, it's been a little slower. It's kind of to be expected when you are dealing with specific populations. And again, now that we're able to open it up to broader groups, we can create the type of environment we need in order to move through vaccine very quickly. With that, I know one of the big questions is always, how much vaccine do we have coming? And looking to tomorrow, that is the day. Tuesday is when we find out how much vaccine do we have coming for the following week. This week coming up, for example, we found out last Tuesday, we're going to have about 32,550 doses that are for state allocation that we can use to administer under our system, and also to share with some providers around the state. In addition to that, 13,650 doses are diverted each week right now to the CVS Walgreens Federal Pharmacy Partner Program, so they can continue their efforts on vaccinating our long-term care centers around the state. Tomorrow is when we find out what we'll receive next week following. At this time, we do not have that information. I can't tell you how much vaccine we're going to get shipped to the state next week. And because of that, that does create some challenges I kind of want to share with you so you kind of understand the logistics of what we're trying to do here. The appointments we mentioned, we have basically our county vaccine is accounted for through appointments that we have set up for this week. Now, we did not yet have our statewide appointment app set up for that. So locally, they used appointment systems to get those clinic pods set up. The appointments have filled, those pods are filled, and that will be for the rest of this week. As soon as we know how much vaccine we get tomorrow, then we go through a process of allocating that to different sites around the state in preparation for pods next week. We will give that information by the end of the day tomorrow. We'll give that to our clinic sites around the state that are receiving vaccine. They will then go in and populate the application with appointment times that match up with the pods that they are able to open. So without knowing how much vaccine we get and where we can go with it, they're not able to add in those appointments. Now, I say that because that kind of explains why it is that we can't keep opening up appointments weeks ahead. We have to do this right now, 1 week at a time, until we get better information from Operation Warp Speed at the federal level and better understand how much vaccine we have moving forward. We really had to do this 1 week at a time. So Wednesday, our teams will populate the appointments in those for those particular pods. And then Thursday, the plan is to roll this out to where the public will have access to go into this appointment scheduling application and actually find a clinic near them. It will screen them for eligibility for the vaccine. It will help them to identify a pod near them, and then they can sign up for an appointment at that time. Now, please understand that this application is for public health use. This is for our pods, our high throughput, large scale vaccination points of distribution. A private provider or a healthcare system, they'll use their own scheduling systems for
community builders. And due to the overwhelming response, we're extending.
All right. So this is for the public health system itself that we'll be using this. So again, look for that to be rolling out on Thursday. I can't tell you how many pods that will include yet. Can't tell you how many appointments that will be involved next week, because again, we're waiting on information on our vaccine. As we're moving through this week, again, the vaccine that we have in the state that we received in the month of December is pretty much allocated and accounted for out there. So there are a few systems, federally qualified healthcare systems that have some vaccine, and some of our larger health systems are still working through some of their healthcare staff. Those are the only ones that are still in question on how much will be left over from that, but pretty much everything else is accounted for. So again, next week, we don't have a known quantity of inventory we can start with. So that kind of gives you an update on where we're at up to this point on the vaccine distribution and kind of our plans moving forward. I think that's probably enough that we could put it out there for some questions and answers.
And I just wanted to clarify, you said 32,550 are coming this week, and then you said 13,650 are diverted to CVS and Walgreens. Does that mean 13,000 of that 32,000?
No, that's a great question. I'm glad you asked that so I can clarify. The 32,550 is what we will have left after the allocation of 13,650. It's diverted directly from Operation Warp Speed to CVS Walgreens. So that's the reason I didn't count it in our total.
And then my other question is, so far we've seen county health departments kind of acting on their own, setting these up these appointments have kind of scattershot. We've heard from locations like doctors' offices that got more vaccine than they were expecting and had to kind of rush around and get that out to people. How will you guys put together a statewide plan so it's not kind of these individual county health departments? I know people are concerned that there's not a statewide coordinated plan right now.
So, I mean, that's a great question, but the big thing that we have in Oklahoma is we have a lot of local resources that are not necessarily the same from region to region. So we do encourage our local health departments, our local health districts to work with their community partners to take advantage of what they have available locally, as opposed to us dictating at the state level exactly how they will roll it out. So in response to your question, since we did not have the statewide app ready to go, and we were still yet ready to administer to 65 plus, and we had vaccine in the freezer, we were not satisfied to set on vaccine in the freezer and then wait for this application to come on board. So that's the reason we gave the green light to local jurisdictions to be able to set up their own pods. They are working under our statewide plan. They received the green light to move forward based on the categories that they had. And so therefore they're moving under that premise. And then later this week, we transition into that statewide appointment app.
Thank you.
Okay, we have Cassie's question posted in the comments. Keith, I'll read it to you. I've seen several counties using apps for people to schedule appointments. Does the state have a plan to get word out about the vaccine to people, especially those over 65, without social media or who don't use apps? And then second part, can we have a breakdown of where pods will be, at least by county?
So let me get that last part first. I can see about getting the number of the pods and where they're located out after this, but we did not put those out in advance because we were managing limited inventory and putting those out locally. And quite frankly, they were filling up very rapidly. So we didn't want to create a lot of chaos on people trying to get into some of these pods on different regions of the state. The question about those that don't use social media, yes, we'll put out messaging locally and state level as to where they can reach out in order to get an appointment outside of this particular system. We recognize that not everybody uses the technology or the applications in order to do that. I would encourage family members that are working with those that are maybe older, that aren't comfortable with the technology. Family members work with them to help them navigate through this, because this is the easiest way to get through. Our phone lines, quite frankly, are experiencing a pretty heavy burden, as you can imagine. Any concern that people aren't interested in getting a vaccine is pretty much out the window from what I can tell, because we are getting a lot of calls and a lot of interest out there on getting vaccinations and getting appointments. So yes, we will put out information on how people can access an appointment outside of this system as well.
Keith, I just want to add to that. This is again somewhere where the media can be helpful in this process. Anyone can dial 211 and get information about where they can go to get a vaccine. And then we also want to talk about our pandemic providers that have signed up that are around the state. So they should be able to call their provider and see if they are a pandemic provider. If not, they might know of one in their community. And I believe those are also going to be listed on our website. Are they not, Keith?
Yeah, that is correct. At this point, the ones that we have sent vaccine to, we started with the federally qualified healthcare centers. Those are some of the providers that you may have heard mentioned that had some significant inventory that they got last week. We don't have yet enough inventory to send it to groups beyond that yet. That's where we're hoping to find out that we've got greater volume coming in each week. And at that point, we will expand out to more and more providers around the state. Currently, we have in excess of 1,000 providers that have applied and have been approved in the system. We have, it was over 600 last time I looked, still in process of those, or in addition to those that are being added to the pandemic provider list. The qualifying factor for that is, though, we need inventory. We need vaccine inventory. And looking ahead, that's one of those questions that we had to get answered on a week-by-week basis. So that's what determines how much we have and the ability to send it out. And once we send it out to these groups, we want to be able to keep them supplied as well, because they also will become a key part of that plan moving forward.
How many vaccines did we end 2020 with?
So we did receive the 174,900 vaccines into the state. That does not include approximately 6,000 that came through federal allocation. If you add that in, that would put us around 180,000 in the state total.
Perfect. And the other question that kind of goes along with Cassie's question, I'm hearing frustration that there are a large number of Oklahomans that don't have access to broadband internet or even computers, particularly in low income and rural areas. And appointments are getting snapped up so quickly that by the time somebody hears about it through word of mouth, they can't get it. What are you guys going to do to bridge the gap between essentially the haves and have-nots and ensure equality in vaccine distribution?
Yeah. Well, that's not an easy question to answer. This is a very difficult program to roll out and to do so to address everybody's needs. One of the things that I think we're looking at is limiting the number of appointments that are made through the app, for example, and then set aside a certain amount of appointments that can be gained through other means to try to help those that are not, who don't have access to the application or the technology to get their vaccine. It's a legitimate concern. It's something that we continue to work through on a day-by-day basis. And quite frankly, this whole process, we need to just be clear on this moving forward. This is going to be a very difficult process, and it's going to be a long process, and there's going to be a lot of challenges. In order to try to keep everything completely fair and on the same level, that's going to be a very difficult thing, because those that are quicker on the draw are likely to get the vaccine quicker, and unfortunately in some of these cases. So we just need to keep providing opportunities. We need to get more vaccine in and provide as many opportunities as we can so the public can access their vaccine. But we're certainly looking at the issue of those that don't have the technology that they need in order to use the systems that are most easily accessible, and then make some accommodations. And then, like I said, one way of doing that is to reserve a certain amount of appointments around the state for your typical phone call or other means by which to get that.
We're hoping to have the opposite problem soon. We're hoping to have enough vaccine to where we can just start vaccinating everyone, and there won't be a waiting list, so to speak, because of lack of supply of vaccine. But we'd like to get this vaccine out as quick as we can. We want to try to make it available to every single person, and we'll keep working it until we get there. But unfortunately, right now, our supply is not as robust as we'd like for it to be.
Okay. Paul Moniz?
Yes, thanks for holding this briefing. Just had a quick question about the second dose appointments. I mean, obviously, when that comes up in 2 or 3 weeks for folks who got the first dose, how is that going to piggyback on top of the existing scheduling app, and how are you going to manage that just from a logistical standpoint in terms of people are coming in for maybe their first dose with other people coming in for their second dose, and will there be kind of a bottleneck there? And then second of all, I've heard that people are kind of traveling, the ones that are lucky enough to get an appointment are traveling across counties to go to maybe more rural counties from urban areas, and even maybe from border states coming into the state. I mean, is the screening in the app take care of some of that, or what's the plan for that?
So the screening in the app will identify addresses. We are not limiting somebody to be a resident of a particular county or something in order to get vaccine. A lot of people travel to work, and there's a number of circumstances that might require somebody to get a vaccine in an area that they don't reside in. We're working hard to try to keep this for Oklahoma residents. Early on, when we were doing healthcare providers, we did have those vaccinated that may have come from out of state that work in our healthcare systems, which makes sense. We're trying to keep our healthcare systems propped up, and we're trying to make sure that their staff remains healthy. So those workers, we're just more worried about where they're working for those. Second dose, that's a great question. And as we move through this process, one of the things we need to do is we need to kind of diversify where our vaccine goes so that we increase our capacity. So we have to account for the fact that these clinics are going to have to repeat themselves essentially in 4 weeks, which right now the primary vaccine that is given through these pods is Moderna vaccine, which is repeated in 28 days. So we have to recognize that these large-scale clinics will have to repeat themselves in 28 days. That's where we need to really look at diversifying where we put new vaccine out to. And that's something I can kind of introduce you to some terminology that you'll probably start hearing more, and that's the prime dose and the boost dose. Prime dose meaning vaccine that represents a new Oklahoman getting vaccinated. It's probably the best way I can explain it. And then the boost dose is that secondary shipment that we get coming into the state that is specifically designed for the repeat dose. So it doesn't represent a secondary, or it doesn't represent a new Oklahoman getting vaccinated. So when we talk about, for example, the 32,550 we'll have this week coming in to work with, we will get additional vaccines starting to come in as well that represents the boost doses. Those are designated for the repeats. So yes, it's a challenge, and it's another example of how difficult this process is going to be moving forward. And another reason we ask for patience from the public as we work through this process. And the reality is, it's not going to be as simple as everybody gets a appointment, out over the next several weeks, and I can just give you an appointment and guarantee you this is when I know I'm going to have vaccine and where we can get you taken care of. That's why we had to work, a week at a time right now on that. But in answer to your question, at the time when we start to have to repeat these, we're really going to have to diversify where we send vaccine so that we can get it spread out and more of those pandemic providers can come into play.
Quick follow-up on the prime and the boost dose. I mean, functionally they're the same vaccine, right? There's no it's not a watered down version the second time around, right?
That's correct.
Okay, thanks.
Yeah, it is the same dose, but it's part of the logistical setup by Operation Warp Speed to ensure that we have the second dose so that we can maximize protection for the residents that were vaccinated. If we went through and we did not carefully manage that vaccine and set it aside for that second dose, then we risk giving people only partial protection from COVID-19. And we want to make sure that we get the full benefit of this great vaccine so that they have that 95% protection.
Thank you.
Okay, we'll go to Carmen with the Oklahoman.
Hi, thank you so much for your time. I have two quick questions. First one being, why are some pods in some localities vaccinating those who are 65 and older, whereas some localities are not? And then my other question is, I'm just curious why the app wasn't finished yet or wasn't ready to roll out by this point in time.
Okay. So two great questions. The first one, so different parts of the state are at different stages when it comes to vaccine administration for first responders and some of the healthcare workers. If an area of the state is at a point where they have experienced that they can no longer fill up their appointment slots or fill up their clinics with that group, and we are close to being ready in other parts of the state, we're going to go ahead and give them the green light to move on to 65 plus. And the reason for that is vaccine in a freezer doesn't do any good. It doesn't do any good whatsoever in stopping the pandemic or stopping the spread of COVID. It just doesn't help us any. So we've got to get vaccine moving into people. And for us to have a system that would require everybody to move to that next step in lockstep with each other, that would create an inefficiency and leave vaccine in the freezer when it could be protecting people. So there is a little bit of variability with that, and that is just going to be necessary to make sure that we can move vaccine out as quick as possible. The question about the app, Originally, we were planning on using an app that was provided by the CDC, a vaccine administration management system. They called it VAMS. And that was our plan to use that. And when they actually came to the point of rolling it out, it did not quite meet our needs, and it was going to be an all or nothing app. And we felt like that wasn't right for Oklahoma. So we engaged Microsoft to develop this other app for us. We knew we would need it for the pods and the large volume clinics moving forward. So we asked them to put that together. And they've done a great job of putting together. But as you can imagine, when you have a short time frame to put something like that together, you do have occasional delays. On this particular case, we just had a few days delay because of getting the pod sites entered into that particular system. It was just a back end update that needed to be done, and that was it. It's really just that simple. The other part of that is we started moving through quicker than we thought we were. And once we identified that we were ready to move with these larger throughput, larger volume clinics, we didn't want to leave vaccine in the freezer. We didn't want to put it into people's arms. So we weren't going to wait on technology to give us the green light to move forward.
And sorry, just a quick follow up. Does the app have a name yet?
It's a vaccine scheduling appointment app. I call it Visa, for lack of a more creative name.
Hi, I was just wondering if county health departments are expected to get any supplemental funding to administer the vaccine program, either now or sometime in the legislative session.
So with the additional act that has recently passed, there is funding in there for vaccine administration. And while I don't have the specific numbers for that, there will be money directed to help support vaccine administration across the state. Yes.
Thank you.
Okay, Angela.
In terms of the phone lines, are there going to be, I guess, like multiple going at once? Because I imagine that once people start calling, it's just they're going to be on hold for possibly hours. And also, is that phone line also going to be put out on Thursday along with the app?
So local phone numbers, we will keep those put out locally. And then you've always got 211 that has a lot of capacity. If we see that our existing phone lines are not sufficient, we will probably expand more with 211 to get greater access for people to reach out, and then divert those to for local information in order to get them scheduled.
Okay, so the main one is 211, but there's other phone numbers that haven't been put out yet that people can use starting Thursday?
Well, there's always your local health departments.
Okay, so people should just go through that. Okay, and then also, I mean, I've heard there's some people who are just driving around looking for places to get vaccinated in places that aren't their county. How do you keep people going from county to county just looking for a place and then taking up all those spots for other people?
So that's a great question. And first of all, I would just really discourage people from doing that. There's a reason that we are using an appointment system. There's a reason that we are not just doing walk-in clinics. We don't want a free-for-all type of environment. We're worried about our 65 plus population, for example, being in a situation where they feel like they have to stand in line to get a vaccine, just in hopes that the inventory will hold up. That's the reason we're using appointment systems, so that when people come in, they know that there is a vaccine that's really set aside for them. So we strongly discourage people from approaching it that way and trying to just drive around and find opportunities to get vaccinated. It's one thing to track and go online and get an appointment, or call to be able to get an appointment and have one locked in, but do not expect to drive around and find available vaccine just because you're out searching for it. That's not the system we're setting up. We do not feel like that's an efficient way to do this. I think it also is not fair to Oklahomans to establish that as an expectation, that that's a method by which they could get a vaccine. We want to use the appointments so that we can match vaccine inventory with the expectation of the public.
Okay, we'll go to Rick with Fox 23.
Before Christmas time, we heard teachers were moving into phase 2, but I did not hear teachers in the early part of this. Is there now a phase 2 group B that teachers are in, or how do we address those other people who are supposed to be in group 2 right now?
So understand that when we talk about the phases, like phase 2 represents a kind of a group of priorities. It's not all inclusive that everybody at once gets eligibility for the vaccine. So what we do when we talk about moving into phase 2, the first few groups into phase 2 include the expanded healthcare workers, first responders, 65 and up, and then also those younger than 65 with comorbidities. Then you get into teachers, then you get into congregate housing. So the group, there's several priority groups within phase 2. So where we're at right now is we have opened vaccine up to the expanded healthcare workers, to first responders, and now to 65 plus. We have not yet opened it up to those under 65 with comorbidities, for example, because our vaccine supply is not sufficient to open it up for that group. And doing so would really create chaos, if you will, on trying to meet all those needs. So we open it up to each group as we get sufficient vaccine and sufficient access to start serving that population. Having said that, I want to clarify again that just because we start with 65 plus doesn't mean that we are stopping with others that were in phase 1, for example. There's still some in phase 1 that are still working on getting their vaccine, and we've got those supplies with our health systems. We have some of those that are going to be getting appointments in these pods we talk about this week. We really try to overlap these systems and add them to our existing efforts so that we can build on them and start providing vaccine to different groups. We don't do them linear. We don't complete one group before we start another. We just start to bring them on board as vaccine supply and access will permit.
My second question is kind of a follow-up to Paul's.
Thank you, County News.
So some states are have actually started to hold back some of their initial vaccine to make sure there is enough boosters. Are you saying that is not state policy to hold?
That's honestly, quite frankly, that's not national policy. Operation Warp Speed has been very clear with us, as they have been with other states, that they are holding back that second dose in shipping it to us in that time frame that we need it for the second dose. If we were to hold back what we receive simply because we didn't trust that system worked, then we would be denying Oklahomans that initial dose and that protection from COVID-19. So this has been an orchestrated plan. It's something that we've got working with Operation Warp Speed. It's something they have built into their system with the manufacturers and the shipping programs in order to provide that to us. So it's earmarked as a boost dose. And we're going with that plan because that gets more vaccine to Oklahomans moving forward.
Thank you.
Basically, I wanted to talk a little bit about that orchestration from the federal level. Not all states are the same demographically. Some have older populations. Some have much worse, I guess, pockets of COVID than others, Oklahoma being one that's had some real problems. So do you know, or can you tell us whether they are distributing the vaccine based partly on those needs, based on the differing demographics of the states and the differing levels of COVID-19 that those states might be experiencing? Or are they simply distributing the vaccines based on population?
It is my understanding from Operation Warp Speed that they are distributing vaccine on a prorated formula based on population. That's correct.
Okay, so it's not really based on, and I guess that's because it's a sort of a fast-moving target.
So I would say that was the information we were initially given when this rolled out in the first couple of weeks of shipments. If there is a change to that, I could see them possibly making some adjustments and start looking at maybe vaccine administration in states, for example, to make determinations about whether they need to ship, but I am not aware of them actually adopting anything like that as policy moving forward. But I will say that we want to make sure as a state that we are taking care of our citizens and we're getting vaccine into people as quickly as possible, so that there's no question that if they send vaccine to Oklahoma, we will get it into Oklahomans and not leave it in the freezer.
And Keith, we were one of the top states in the nation as far as vaccine distribution as well. So we've made it a goal, personal goal of ours, to get the vaccine out as fast as we can. Keith and his team have done an outstanding job of doing that.
You mentioned that you'll only know sort of from week to week how many doses the state will get. And I'm wondering if you know, will there be a minimum at least, or could there be kind of big spikes and drops from week to week?
Well, we're in hopes that it's fairly predictable within a range, and that's what should be happening. But I don't know that for certain. We don't know for sure what we get until, again, right now the schedule is set Tuesday. So tomorrow, sometime before noon, we should be informed of how much vaccine we're going to get shipped to us the following week. I'm hoping it's at least in the range of what we're getting this week. I would hope that it was much, much more. But again, we don't know week to week. And I would say we're really probably too early into this to really be comfortable saying that we're seeing a good trend that says we're at a minimum level.
Okay, we'll do 3 more. Barry with News 9.
Hi, thanks, Anthony. Thank you, everybody, for making yourselves available. I really appreciate the help. I have a question specifically about teachers. I know that they are, you've talked a lot about phase 2 and kind of the scheduling of that. At this moment in time, when do you expect teachers to be able to receive doses, and kind of how long before a substantial amount of teachers are able to receive the vaccine, or when do you hope to be able to vaccinate every pre-K through 12th grade teacher?
I can talk about some of that, Barry, and then I'll get to Keith. We've asked them to prioritize these groups even within their own prioritization. So let's look at teachers, for example. That's a large number of people, so we want them to. Some teachers are higher priority than other teachers. Some of them are over 65. You have some with comorbidities, or you have some in certain jobs that are higher risk than other jobs. So we're hoping to get to those highest priority teachers, start at least with them this week at some point. How long it's going to take to get through all of them, I'm not sure. Keith, do you have a?
Oh, that's my crystal ball's broken on that one. That very much depends on the vaccine inventory coming in. Our hope was that we were going to get enough vaccine inventory that we were just really inundated as a state, and that was going to allow us to send it to those pandemic providers we talked about and create lots and lots of access points. That hasn't happened yet, and it's very possible that we're all just very impatient for that because we want to get this behind us, because we still are very early in this process. But the key to being able to add these other groups on is going to be inventory. At the rate we're going right now, we're going to have to get much further, or quite a bit further into this before we can open it up to different groups. But if our inventory will start really going up based off the federal allocations, then that makes it much easier for us to overlay these groups and not have to wait till we get further into them to start adding those. So the hope would be increased inventory equates to more access points, to more vaccinators, and then we adapt to that with an increase in the eligible categories.
Gotcha. And one quick follow-up to that, just my understanding of how exactly will, you mentioned, Dr. Fry, just the prioritization within teachers. Will the health department be determining that kind of prioritization, or will doses be given to individual school districts to manage? Kind of, I believe I heard at a previous press conference that districts would be receiving their number of vaccines and they would distribute within them. Is that the case, or will they kind of be going through pods? Can you explain the process of that a little bit?
So on the prioritization piece, we actually relied upon the schools to tell us, who's higher priority within their particular job, et cetera. So that's something that we're letting them do individually because they know better than we do on that. And then Keith, on the distribution piece, I'll let you speak.
Yeah, so as we get further into this and we get a larger groups of teachers that are eligible, we will consider options on the best way to get them vaccinated. But I'll be honest with you, depending on the volume we get, it would probably be more likely that we would ask them to come to a pod. I mean, it could be a pod that's set aside specifically for teachers. But what I don't anticipate doing is doing a large-scale sweep of strike teams going to schools to provide vaccination. And here's the reason I say that. That's what we used with long-term care centers, and it makes sense because that's not a population that could get up and leave and go to a pod. Doing strike teams, while it works well for facilities for us to go to, it's not an efficient use of resources. It takes vaccinators, it takes them away from the high throughput setting where they can vaccinate a lot of people. And it also requires a lot of administrative support to make happen. So we want to kind of keep, as much as possible, the public health workforce. We want to keep them in these high throughput settings. Now, as much as we can work with them to maybe provide vaccine, if they have some resources that can help pull some vaccinators together, we can work with them to make it happen that way. But for the most part, I expect that we'll be doing pods at our sites for them.
Thank you.
Okay, Corey with Tulsa World.
Hi, thank you. Appreciate it. So I actually want to do a follow-up on a question Carmen asked a little bit ago for Deputy Commissioner. When you mentioned that the CDC app wasn't quite, what you needed, what the state needed, it was all or nothing. Can you please describe a little bit more about why it wasn't right for Oklahoma and why you had to go with Microsoft to build your own? Like what was it lacking? What didn't work?
Well, the big thing is my understanding of the app was that it was going to require us to require all providers to use that particular app when we have trained providers in across the state that are already trained in using our state immunization registry. So this was going to be a new tool that we would have to overlay on top for all those providers around the state. And when you look at the long-term plan for doing this, we did not feel like that was an effective way to require our pandemic providers to be able to learn a new system. So we recognized that what we really needed was something that was focused for the public health system and that would allow us to kind of customize it for these large throughput clinics. And that's why we chose to go with Microsoft on that.